مرحبا. هسه احنا بالبارت الثاني chapter الأول وصلنا صفحة 101. Part mallet and chisel. Occasionally bone removal is performed using a mallet and chisel. احنا البداية قلنا عندنا الرونجر يشيل كميات صغيرة، عندنا الهاند بيس والبير هي أكثر شيء يستعمله الجراح، وعندنا هاي شيء قديم المالت and chisel. Although the availability of high-speed hand piece for removing bone and sectioning teeth has greatly limited the need for mallet and chisel. يعني هاي الشيء قديم، من جتنا الهاند بيس بعد صار استخدامهن محدود. The mallet and chisel are sometimes used in removing lingual teeth. The edge of the chisel must be kept sharp if it is to function effectively. Bone file هذا نستعمله بالقلع. Final smoothing of bone before completion of surgery is usually performed with a small bone file. هو ينعم شلون مالات الاندو الفايلات، هو هذا اكو مثلا فايل مال اظافر، وهي فكرته انه ينعم كأنه ما تبرد الاظافر، تبرد العظم. The bone file is usually a double-ended instrument with small and large ends. The bone file cannot be used effectively for removal of large amount of bone. هو مو مزيل للعظم، هو ينعم العظم، يبرد العظم. Therefore it is used only for final smoothing. The teeth of most bone files are arranged in such a fashion that they properly remove bone only on a pull stick. يعني مو تجيبه وترجعه، حركته باتجاه وحده، تسحب بول ستروك، يعني سحبه تجره دخله داخل السوكت وتسحبه لبرا وترجع تدخله، مو تروح وترجع. Pushing this type of bone files against bone result only in burnishing and crushing the bone and should be avoided. Okay, ما يصير تسوي pushing. Removing soft tissue from bony cavities. The curate commonly used for oral surgery is an angled double-ended instrument used to remove soft tissue from bony defects. الكيورات تزيل السوفت تيشيو من الكافيتي داخل البون. Its principal use is to remove granulomas or small cysts from periapical lesion. But the curate may also be used to remove small amounts of granulation tissue debris from a tooth socket. Larger يعني هي انه نفيدنا من انه احنا عندنا بون وصاير بيه جرانيولوما او سيست، بس عادي مثلا من نقلع سن وعندنا جرانيولوما هم نشيلها عادي. Larger curates are available for removing soft tissue from larger bony cavities such as cysts. Note that the periapical curate is distinctly different in design and function from the periodontal curate. عندنا periapical curate وعندنا periodontal curate. periapical شوف هسه يقول لك It's a principle used to remove rangioma or small cysts from periapical lesion. هذا الأصلية. But the curate may also use to remove small amount of okay. هسه وين هن الكيورات وهاي سوالف ذني. ال A double ended bone file، هذا البون فايل. ال B هم بون فايل. هاي الكيورات، هذا بون فايل وهاي كيورات. هاي تشيل لنا soft tissue then chisel والمالت، وهذا needle holder. بالسوتشرينج نستعمله. يختلف النيدل هولدر عن الهيموستات. هذا الهيموستات مو بس لأنه هذا راسه معقوف، لا ما له دخل، مرات يجي الهيموستات راسه عادل عادي جدا. هاي النيدل هولدر. suturing soft tissue. البيك مالت النيدل هولدر تكون بلانت وشورت. suturing soft tissue. Once a surgical procedure has been completed, the mucoperiosteal flap is returned to its original position and held in place by sutures. Okay, periosteal flap. The needle holder is the instrument used to place the suturing. Needle holder اللي هو هذا. The needle holder is an instrument with a locking handle and a short blunt beak for intraoral placement of sutures. 7 inch يعني 15 سنتيم needle holder is usually recommended يعني نص طول المسطرة. The beaks of a needle holder are shorter and stronger than the beaks of a homostat. هيك نفرق بيناتهم. تكون short و strong. The face of the shorter beak of the needle holder is cross-hatched على شكل صليب to permit a positive grasp of the suture to permit تسمح positive grasp of the suture needle. الهيموستاز has parallel الجروف مالته موازية لبعض تقابل بعض مو مشخطة مو تعبر على بعض. مال النيدل هولدر واحد فوق الثاني مال الهيموستات واحد بصف الثاني. Has parallel grooves on the face of the beaks thereby decreasing the control over needle and suture. Therefore the hemostat is not an instrument used for suturing. ما يسيطر على النيدل تفلت منه تشرد منه تفلت. To control the locking handle properly and to direct the long needle holder, the surgeon must hold the instrument in the proper fashion. The thumb and ring finger are inserted through the rings. The index من ندخلين بالحلقات الثumb والring يعني الأصابع الوسط والإبهام. أوكي الثumb لازم يعني شلون واحد مقابل الثاني are inserted through the rings. The index السبابة finger is held along the length of the needle تمشي على طول النيدل holder to steady and direct it هو اللي يوجهه ويثبته. The second finger اللي الخنصر البنصر aids in controlling the locking mechanism البنصر يتحكم منه بالlocking mechanism هو اللي يفتح لنا القفل ويسده. The index finger should not be put through the finger ring because this will result in a dramatic decrease in control. مفهوم؟ ممنوع الاندكس على طول النيدل هولدر ممنوع يدخل. شوفوا هنا المفروض هو كاتب لنا انه الميدل فينجر يدخل بالحلقة. شو هنا غير شكل داخل. To control the thumb and ring finger. سوري هما الرينج فينجر مو الميدل. سوري خطأت. الثumb والرينج فينجر البنصر يقصد البنصر والاندكس يعني باعوا الميدل فينجر والخنصر لأني يفتح لنا ويسد لنا. اوكي هسه شنو وين وصلنا؟ السوتشر needle. The needle used in closing oral mucosal incision is usually a small half circle نص دائرة or 3/8 circle 3 أثمان circle suture needle. The needle is curved to allow it to pass through a limited space where a straight needle cannot reach, and passage can be done with a twist of the wrist. يعني نعقص الساعد مالتنا الرست. لا مو الرست مو الساعد ما أعرف. Suture needle come in a large variety of shapes from very small to very large. The tips of suture needles either شوفوا هاي الشسمة النيدل هولدر. شوفوا الهيموست النيدل هولدر هاي اللي على اليسار الهيموستات اللي على اليمين. اوكي left هيموستات على اليمين كاتبينه، وهذا هنا فوق كماتين، فرق بيناتهن. يقول لك needle holder تكون أصغر أقصر وأقوى. يعني هسه اللي على اليمين مفروض needle holder. خلينا نشوف بالله. الهيموستات top has a longer thinner beaks مقارنة بالنيدل هولدر البوتوم. شوفوا يقول هاي الفوق اللي على اليسار هيموستات. هسه السوتشر نيدل يقول لك آخر شي the tips of suture needles either are tapered like sewing needles مدببة. لا مو مدببة tapered يعني مدببة like sewing needles مع الخياطة مع الملابس or have triangular tips that allow them to be cutting needles. اوكي يعني تقطع باللحم وتدخل مو عمية. A cutting needle will pass through the mucoperiosteum more readily than a tapered needle. صح. العمية احتمال تمزقه، بينما الكتل cutting will pass through the mucoperiosteum more readily. أفضل. The cutting portion of the needle extends about 1/3 the length of the needle and the remaining portion of the needle is rounded مدور. Tapered needle العمية are used for more delicate tissue. التشيو الرقيق هذا ما يتحمل. As in ocular or vascular surgery, care must be taken with cutting needles because if not used correctly they can cut through tissue lateral to the track of the needle. The suture material used for oral surgery is usually purchased already swaged يعني swaged on by fusing the end of the suture onto the needle. تجيك جاهزة الخيط والإبرة سوية، وهذا manufacturer المصنعين. The curved needle is held approximately 2/3 of the distance between the tip and the base of the needle. Okay, this allows enough of the needle to be exposed to pass through the tissue when allowing the needle holder to grasp the needle in its strong portion. يعني شنو يقول لنا ال curved needle is held approximately 2/3 of the distance between the tip and the base. نلزمها من مكانها strong to prevent bending of the needle or dulling of the tip. technique يعني نلزمها قريب على الحافة تقطع. Techniques for placing suture are further discussed بالشابتر الثامن. Suture material. Many types of suture material are available. The materials are classified by diameter, resorbability, and whether they are monofilament or polyfilament. The size of suture relates to its diameter and is designed by a series of zeros. The diameter most commonly used in the suturing of oral mucosa is 3 إلى 0 3 صفارة يعني 3 صفارة. Larger size suture is 2 or 0. Smaller size are designed with more zeros. For example 4 و5 و7 صفار. Suture of very fine size such as 7 are usually used in conspicuous. احنا نسوي الأسنان قلنا شو نستعمل؟ قلنا نستعمل 3 conspicuous places on the skin. أماكن واضحة على البشرة استعملها 7. بينما شو يقول لك diameter most commonly used in suture oral mucosa 3. 7 على الأماكن الظاهرة على البشرة. For example the face because properly placed smaller suture usually cause less scarring. Suture of size 3 are large enough to withstand the tension تتحمل tension placed on them intraorally حتى تقدر تمارس وظيفتها بشكل طبيعي يعني and strong enough for easier knots tying with a needle holder compared with the smaller diameter sutures. يعني أسهل بالاستعمال ليش معقدة ومستبعة. Sutures may be resorbable or non-resorbable. Non-resorbable suture material include such types as silk, nylon, vinyl هذني non-resorbable and stainless steel. شو يكونن؟ silk, nylon, vinyl and stainless steel. The most commonly used non-resorbable suture in the orchidea is silk. يعني هسه هذني تستعملوهم بالعيادات silk. Nylon, vinyl and stainless steel are rarely used in the mouth. Resorbable suture are primarily made of gut. Although the term catgut is often used to designate this type of suture, gut actually is derived from the serosal surface of sheep intestine. شو معنى serosal؟ ما عرفت شو معناها. Plain catgut resorb quickly in the oral cavity, rarely lasting longer than 3 to 5 days. Gut that has been treated with a tanning solution, chromic acid, الgut اللي محطوط له حمض الكروميك is called chromic gut and lasts longer than plain gut by up to 7 ل 10 أيام. نحط لها الgut نحط لها كروميك حتى تزيد المدة مالتها. Last longer. Several synthetic resorbable suture are also available. These هسه الطبيعية الgut بس عندنا synthetic. These material consists of long chains of polymers braided into suture materials. Examples are polyglycolic acid and polylactic acid. These materials are slowly resorbed, taking up to 4 weeks to do so. Such long-lasting resorbable sutures are rarely indicated for basic oral surgery. Finally, يعني ما نستعمل إذا أريد نستعمل catgut ومن هي نوع الكروميك. Finally, sutures are classified on the basis of their being monofilament or polyfilament. Monofilament suture are sutures such as plain and chromic gut. then من monofilament شو من البلين والكروميك gut يعني الجات اوكي. النايلون وستانلس ستيل then شو يكونون monofilament يعني شريط واحد مو ضفيرة. polyfilament sutures are braided sutures such as silk يعني مظفور silk, polyglycolic acid and polylactic acid. هسه من المظفورات السلك والبوليغلايكيك والبوليلاكتيك. من المونو الجات والستيل والنايلون. Sutures that are made of braided material are easier to handle and tie than monofilament suture and rarely come united. The cut ends are usually soft and non-irritating to the tongue and surrounding soft tissue. However, because of the multiple filaments, they tend to wick oral fluids around. Hello. To wick oral fluids along. الوك معناها تسحب السوائل oral fluid along the suture to the underlying tissue. This wicking action may carry bacteria along with saliva. Monofilament suture do not cause this wicking action but may be more difficult to tie and tend to come untied تنفتح لوحدها. Also the cut ends are stiffer, being more irritating to the tongue and soft tissue. يعني المونوفيلامنت احنا ما يفيدنا لأنه stiff. one of the most commonly used suture for the oral cavity is احنا قلنا 3 صفارة وبلاك silk. The size 3 صفارة has the appropriate amount of strength. The polyfilament nature of the silk makes it straightforward to tie and well tolerated by the patient's soft tissue. هم سهل إنه نربطه وهم يتحمله البيشنت. The color makes the suture easy to see when the patient returns for suture removal. Sutures that are holding mucosa together usually stay no longer than 5 to 7 days, so the wicking action is of little clinical importance. Many surgeons prefer 3 chromic suture to avoid the need to later remove it. Techniques for suturing and not tying are represented in Chapter 8. Scissors. The final instrument is necessary for replacing suture are suture scissors. Suture scissors usually have short cutting edges because their role purpose is to cut suture. هي تقص الخيط فراسها يصير صغيروني. The most commonly used suture scissors for oral surgery are Dean scissors. Okay? These have slightly curved handles and serrated blades that make cutting sutures easier. serrated أعتقد معناها مخططة مسننة. Serrated blades that make cutting sutures easier. Suture scissors usually have long handles and thumb and fingers rings. The suture تكون have long handles and thumb and finger rings. Okay, scissors are held in the same manner as needle holder. يعني ندخل الثumb والإصبع الثاني اللي نحط بيه الرينج يدخلن بالحلقات مال السيزر. Other types of scissors are designed for cutting soft tissues. The 2 major types of tissue scissors are iris scissors and Metzenbaum scissors. These scissors من الإيرس والمتزنباum للsoft tissue. These scissors can have straight or curved blades. احنا قلنا الدين يكون curved. Iris scissors are small, sharp pointed, delicate tools used for fine work. Metzenbaum scissors are used for undermining soft tissue and for cutting. تقويض undermining ضعف التشيو و for cutting. They can have either sharp or blunt rounded tips. من هذين Metzenbaum. The tissue scissors such as iris or Metzenbaum scissors should not be used to cut sutures because the suture material will dull مادة قوية فراح تعمينا الedges of the blades and make them less effective and more traumatic when cutting tissue. Holding the mouth open is performing extracting إنه holding the mouth إبقاء الفم مفتوح in performing extraction of mandibular teeth أثناء قلع الأسنان بالفك السفلي. It is necessary to support the mandible to prevent stress on the temporomandibular joint. هاي أول قاعدة نتعلمها. Supporting the patient jaw on a bite block will help protecting the joint. The bite block is just what the name implies. يعني نفس اسمه شغلها إنه يعض أو يمنع العضة إنه يمنع البشت من الإطباق الكامل. It is a soft rubber-like block on which the patient can rest his or her teeth. The patient opens the mouth to a comfortably wide position. The rubber bite block is inserted and the block holds the mouth in the desirable position without effort on the patient's part. Bite blocks come in several sizes to fit variously sized patients and produce varying degree of opening. Should the surgeon need the mouth to be opened wider using any size of bite block, the patient must open his or her mouth more widely and the bite block must be positioned more to the posterior of the mouth. For most adult patients, the pediatric sized bite block is adequate when placed over the molar teeth. يعني عاد تستعملها الأدلت بس حطها بجهة المولارات. The side action mouth probe or Mallet mouth probe can be used by the operator to open the mouth wider if necessarily. من هو هذا side action أو المالت؟ من هو المالت؟ هذا المالت. The side action مالت يفتح الماوث wider if necessarily. This mouth probe has a ratchet type action. شو معناها ratchet؟ A device bar wheel with a set of angle teeth and measure cog provided that perceived to be changed. ما فهمت. ratchet. يعني تزيده حسب اللي انت تريده يعني تكبر ويصغر. Type action opening the mouth wider as the handle is closed. This type of mouth probe should be used with caution because great pressure can be applied to the teeth and the TMJ and injury may occur with injurious use. injurious غير حكيم. Yes. This type of mouth probe is useful in patients who are deeply sedated يعني ما يقدر يسيطر على شلون يفتح حلقه or have mild forms of trismus عضلاته مش شنجة ما يقدر يفتح. Whenever a bite block or side action mouth probe is used, the surgeon should take care to avoid opening the patient's mouth too much because it may cause stress on the TMJ. Occasionally, this may result in stretch injury to the joint necessitating additional treatment. When long procedures are being performed, it is a good idea to remove the probe periodically and allow the patient to move the jaw and rest the muscle for a short time. اللي هو هذا شو اسمه Mallet. Removing fluids to provide adequate visualization. Blood, saliva, and irrigation solution must be removed from the operative side. Surgical section has a smaller orifice than the type used in general dentistry to more rapidly evacuate fluids from the surgical side to maintain adequate visualization. Many of these section tips are designed with several orifices so that the soft tissue will not become aspirated into the suction hole and cause tissue injury. The Fraser section has a hole هاي اسمها نوع من السكشنات اسمها Fraser hole in the handle portion that can be covered with a fingertip as needle. When hard tissue is being cut under copious irrigation, the hole is covered so that the solution is removed rapidly. When soft tissue is being suctioned, the hole can be left uncovered to prevent tissue injury or soft tissue obstruction of the suction tip. أكو فتحة إذا ندوسها يصير شفط أسرع، إذا نوخرها الشفط يصير أقل. Holding towels and drapes in position اللي قبل شوي قلنا إنه تحمل تشيل اللسان هماتين. when drapes are placed around a patient. احنا شنو ترجمتها هاي drapes؟ ستائر are placed يعني towel are placed around a patient. They can be held together with a towel clip. This instrument has a locking handle and finger and thumb rings. The action ends of the towel clip can be sharp or blunt. Those with curved points penetrate the towels and wraps. When this instrument is used, the operator must exercise extreme caution so as not to pinch the patient underlying skin لأنه بيها أسنان. Okay. Irrigation. When a handpiece and burr are used to remove bone, it is essential that the area be irrigated with a steady stream of irrigation solution, usually sterile saline or sterile water. The irrigation cools the burr and prevents bone damaging heat build-up. The irrigation also increases the efficiency of the burr by washing away bone chips from the flotch of the burr and providing a certain amount of lubrication. In addition, once a surgical procedure is completed and before the mucoperiosteal flap is sutured back into position, the surgical field should be thoroughly irrigated. A large plastic syringe with a blunt 18 gauge needle is commonly used for irrigation. Although the syringe is disposable, it can be sterilized multiple times before it is discarded. The needle should be blunt and smooth so that it does not damage soft tissue, and it should be angled for more efficient direction of the irrigating system. وهذا احنا نعوجها. Extracting teeth. One of the most important instruments used in the extraction procedure is the dental elevators. These instruments are used to loosen teeth from surrounding bone. Loosening teeth before the application of the dental forceps makes extraction more straightforward. By elevating teeth before the application of the forceps, the clinician can minimize the incidence of broken crowns, roots, and bone. Finally, luxation of teeth before forceps application facilitates the removal of a broken root. Should it occur because prior elevator use is likely to have loosened the root and the dental socket. In addition, هاي السكر الجراحية قلنا B, the farther section tip has a blade in the handle to allow the operator more control. Anyways, then is surgical section. In addition to their role in loosening teeth from surrounding bone, dental elevators are also used to expand alveolar bone. By expanding the bucco-cervical plate of bone, the surgeon facilitates the removal of a tooth that has a limited and obstructed path for removal. Finally, elevators are used to remove broken or surgical sectioned roots from their sockets. يعني بس نطلعه. Dental elevator. The three major components of the elevator are the handle, والshank, والblade. The handle of the elevator is usually of general size, so it can be held comfortably in the hand to apply substantial but controlled force. Substantial شنو معناها؟ أعتقد معناها قوية. يعني قوة قوية هي but controlled مسيطر عليها. The application of specifically applied force is critical in the proper use of dental elevator. لازم تكون يعني specific. In some situations, crossbar or T-bar handles are used. These instruments must be used with great caution because they can generate excessive amount of force that can fracture both teeth and bones. The shank of the elevator simply connects the handle to the working end or blade of the elevator. The shank is generally of substantial size and is strong enough to transmit the force from the handle to the blade. The blade of the elevator is the working tip of the elevator and is used to transmit the force to the tooth, bone or both. Type of elevators. هاي هنا تو الكليب اللي قبل شوية شرحناها. بعدين الاليفيترات هاي التي، هاي الاريجيشن، شو شلون كاسرين عاوجين النيدل مالها. هسه type of elevator. The biggest variation in the type of elevator is in the shape and size of the blade. شلون تتنوع بالبليد. The three basic types of elevators are the straight type, the triangle or bonnet shape type, and three, the big type. شنو The straight elevator is the most commonly used elevator to luxate teeth. The blade احنا عندنا triangle وعندنا البيك اعتقد اللي بيها اسنان. The blade of the straight elevator, high straight elevator, لأن كلها straight elevator. هذني هم straight elevator. ذني اللي حشوا عيان. البي triangle اللي هي الكراير، يعني نشد بيها الروت، ميشيال لودستر روت. والهاي الكراين بيك is a heavy instrument used to elevate whole roots or even teeth after the purchase point has been prepared with a burr. لازم نحفر لها مكان. A concave surface on one side that هسه أقول لك يمكن البليد. The blade of the straight has a concave surface on one side that is placed toward the tooth. الجزء المحفور المقعر يصير باتجاه التوث to be elevated. The small straight elevator is frequently used for beginning the luxation of an erupted tooth before application of the forceps. من هي number 301. وينها 301؟ يمكن هي هاي، ما أعرف والله. Larger straight elevators are used to displace root from their socket and to luxate teeth that are more widely spaced, or they are used once a smaller size straight elevator becomes less effective. إذا استعملنا صغيرة وصارت بعد ما تشتغل نجي فوق وحياها أكبر. The most commonly used large straight elevator is the number 34, but the number 46, number 77 elevators are also used occasionally. The shape of the blade of the straight elevator can be angled from the shank, allowing this instrument to be used in the more posterior aspect of the mouth. Two examples of the angled shank elevator with a blade similar to that of the straight elevator are the Miller elevator and the Potts elevator. ما أعتقد جوز جوا حاطيهن، ما حاطيهن بالباراجراف. The second most commonly used type of elevator is the triangle elevator, الكراير. These elevators are provided in a pairs, a left and a right. The triangular elevator is most useful when a broken root remains in the tooth socket and the adjacent socket is empty. يعني طلعنا روت وبقى روت. A typical example would be when a mandibular first molar هي أكتر شي is fractured, leaving the distal root in the socket but the medial root removed with the crown. The tip of the triangle elevator is placed into the socket with the shank of the elevator resting on the buccal plate of bone. The elevator is then turned in a wheel and axle rotation. The elevator is then turned in a wheel and axle عتلة يسموها هو هالطريقة مالتنا wheel and axle عتلة والمحور هيجي rotation with the sharp tip of the elevator engaging the cementum of the remaining distal tooth. The elevator is then turned and the root is delivered. Triangular elevator come in a variety of types and angulation, but the cryer elevator is the most common type. Whereas these elevators are also commonly referred to as east-west elevator. واحدة east واحدة west. The third type of elevator used with some frequency is the big type elevator. This type of elevator is used to remove roots. The heavy version of the big is the crane big. The heavy version. This instrument is used as a lever to elevate a broken root from the tooth socket. Usually it is necessarily يعني ضروري to drill a hole with a purchase point يعني دخلت نقطة إدخال أو approximately 3 mm deep into the root just at the bony crest. The tip of the pick is then inserted into the hole and with the buccal plate of the bone as a fulcrum. The root is elevated from the tooth socket. Occasionally, the sharp point can be used without preparing a purchase. يعني عادي ما تحتاج by engaging the cementum or the forcation of the tooth. The second type of pick is the root tip pick or the apex. هي الأبيكسو. Apex elevator. The root tip pick is a delicate instrument that is used to tease small root tips from their sockets. It must be emphasized that this is a thin instrument and should not be used as a wheel and axle or lever type of elevator such as the cryer elevator مو root كامل or the crane pick. شو معنى emphasize؟ أعتقد يعني من الضروري إنه نوضح تأكيد. The root tip pick is used to tease the very small root end of the tooth by inserting the tip into the periodontal ligament space between the root tip and the socket wall. This instrument works best on roots left after a tooth has been well elevated. Periotomes are instruments used to extract teeth while preserving the anatomy of the tooth socket. The general principle behind their use is to sever some of the periodontal ligament of the tooth. هاي tooth tip used to ease root tip fragment from the socket. يعني هاي الأبيكسو وهاي periotome with a handle and exchangeable blades. Other type of them have fixed blade and are connected to the motor. هاي البريوتوم شو قلنا إنه يحافظنا على السوكت. To facilitate the removal, there are varying types of periotomes with different blade shapes. The tip of the periotome blade is inserted into the periodontal ligament space and advanced using pressure in the apical direction along the long axis of the tooth. It is advanced about 2-3 ملم and then removed and reinserted into an adjacent accessible site. شنو فكرتها؟ البليد مالته inserted into the periodontal ligament space and advanced using pressure in the apical direction. ندخله apical ندخله لجوا ويا اللونج axis مو فنسوف الزاوية. It is advanced about 2-3 مليم and then removed and reinserted. ندخلها 3 مليمات ونرجع نطلعها into an adjacent accessible site. The process is continued around the tooth, gradually advancing the depth of the periodontal tip while progressing apically. شوي شوي ندخلها apically. Once sufficient severeness of periodontal ligament has been accomplished, the tooth is removed by using a dental elevator, extracting forceps or both, taking care to avoid excessive expansion or fracture of bone. Extraction forceps. The extraction forceps are instruments used for removing the tooth from alveolar bone. Ideally, forceps are used to lift elevator luxated teeth from their socket rather than to pull teeth from their sockets. When properly used, they can also help to expand bone during extraction. Forceps are designed in many styles and configuration to adapt to the variety of teeth for which they are used. Each basic design offers a multiplicity of variations to coincide with individual operator preferences. This section deals with the basic fundamental designs and briefly discusses several of the variation. Forceps components. The basic components of dental extraction forceps are the handles, hinge, and beak. The handles are usually of adequate size to be used comfortably and to deliver sufficient pressure and leverage to remove the required tooth. The handles have a serrated surface to allow a positive grip and to prevent slivage.